export to other countries. They're glorified in other countries that also took a handle and a beating. Their health systems were all beaten up as well.
We started with one laboratory and now we have around 229 labs servicing the entire country. We started with 300 tests per day and now we've tested a total of around 9 million samples. And finally, we did have one isolation facility very early on in New Clark City, and now we have around 9,000. I think from us, people working in the health sector for a long time, we know that there have been challenges, primarily in investments, in facilities, and in human resources, far longer than when the pandemic started.
The situation is getting worse. The OCTA research team changes its projection and now sees the country having at least 8,000 daily COVID-19 cases by the end of the month. As infections continue to surge in Metro Manila, more local government units have started implementing localized lockdowns. No word yet, though, as to whether NCR will revert to a stricter community quarantine, but the extended metro-wide curfew begins tonight. The Health Department confirms the detection of a new COVID-19 variant first found in the Philippines. Meanwhile, the DOH also confirms that the Brazilian P1 variant has reached our shores. And over in the Vatican, Pope Francis leads the celebration of 500 years of Christianity in the Philippines. Fast, focused, and fearless. Here's everything you need to know as you jumpstart your day. I'm Charles Lejano. The OCTA research team is now projecting new COVID-19 cases to average at least 8,000 daily by the end of the month. In an interview with One News, OCTA research fellow Professor Guido David says the virus reproduction rate now stands at 1.9. This signals a further increase in new infections in the coming weeks after reaching a fresh 7-month high over the weekend. Despite this, David says there is hope that the interventions sought by the government would help bring the number of cases down.
We're hoping that some of the measures being implemented by the government, the local governments, will slow it down or will start to slow down the spread of the pandemic. We don't expect the numbers to start decreasing already. They'll still increase, but we're hoping at least that the reproduction will somehow decrease.
But David has also drawn the worst-case scenario, which sees the country moving back to the stricter ECQ status. That's if we fail to turn around current transmission trends.
If we can start to see a decrease in the reproduction number and a slowdown of the pandemic, maybe it will not be necessary to move to MECQ. But if nothing changes, or if the slowdown is not something that we're seeing, or if it's too slow. I mean, the slowing down is happening at a slow rate, then MECQ could still be on the table.
More Metro Manila mayors are enforcing localized lockdowns to curb the spread of COVID-19. Zones 1 and 2 in Makati City have been declared as critical zones and are placed under lockdown until March 16. Meanwhile, the city government of Mandaluyong has placed zones 4, 5, and 9 under granular lockdown until March 18. Over in Muntinlupa, Crucero Street in Barangay Tunasan and 124 Purokwan in Barangay Kupang have been locked down until March 28. That is due to a fresh spike in infections. While a total of 23 areas are now included in Quezon City government's special concern lockdown, which will last until March 27. Apart from lockdowns, Metro Manila mayors are also implementing other city-wide measures to protect its citizens against the coronavirus disease. The Quezon City government is reimposing a 2-week liquor ban, while all gyms, spas, and internet cafes must also be shut down. Plus, returning overseas Filipinos staying in Quezon City establishments are required to complete the mandatory quarantine period regardless of swab test results. Meanwhile, Manila Mayor Isko Moreno has ordered all city government offices to allow only 30% of their employees to physically return to work. And Navotas Mayor Toby Tiangco has signed the city ordinance on using RT-PCR testing as penalty for first-time quarantine violators. A second swab test may be imposed for repeat offenders if the violation was incurred 14 days after the first offense. That's on top of imposing a fine of 500 pesos. Health experts are urging Filipinos to strictly follow minimum health standards. This as the Health Department confirms the emergence of a homegrown variant called the P3. UP National Institute of Health's Dr. Eva de la Paz emphasized that the prevent, detect, isolate, treat, and reintegrate strategy is very important to contain the virus. De la Paz noted that when followed correctly, these practices will also help lessen the chances of developing more mutations.
Every infected person or it's a chance for the virus to mutate itself. So the more cases we have, the more chances the virus has to mutate. And so if we bring down the cases, then that in itself is a way of lowering down the chances that the virus will mutate and come up with this new variant of concern.
Infectious disease expert Ron Jean Solante also echoed the calls to follow health protocols even in the household. This as more Filipinos are getting infected within their homes. However, Solante said it is still too early to say whether the emergence of the new COVID variants are directly linked to the spike in cases.
If you look at the number of the cases confirmed with this new variant, napakababa pa ng mga nakikita natin. No? Like for example, the B117, no? More or less 117, something like that. And then yung South African variant, which is the highly transmissible variant, we only have like 90 cases. No? So siguro we'll wait for the further analysis of the surveillance kung talagang this is already widespread. And more or less, we can totally say na an important factor here is really the presence of this variant.
What is the best COVID-19 vaccine? Emory University's Carlos De Rio answers that question on Bloomberg Quick Take. Let's listen in.
The best vaccine is the one you can get into your arm. All the vaccines that are currently available are actually very effective in preventing you from getting sick, preventing you from dying, preventing you from getting hospitalized with COVID. So I would say, take the vaccine being offered to you. The most important thing is to be vaccinated. Some vaccines may be better against some variants than others. Some vaccines may be better in older people than others. I think we still need a lot of research to understand that data. Some vaccines may have longer protection time than others. The research has not ended. Right now, what we have is emergency use authorization. That means there's a public health emergency and the vaccines are being authorized to use because of the public health emergency. But they're not yet fully authorized, and that is pending some more studies. And, research is still happening. We're in the middle of this crisis. We're trying to get over the crisis. Then we'll figure out what happens long term. But in the meantime, even one vaccine is better than no vaccine. And get vaccinated because, what will happen later? It reminds me about the early years of HIV. We use antiretrovirals and we said, cure the antiretrovirals you have. And we're starting an antiretroviral therapy and we saved thousands of lives by starting people in what I think were not the best antiretroviral drugs. Even back then, even in the US, we're using drugs. And nowadays, I get chills to think that we were actually giving that to people, but it saved lives. Now, if somebody back in 1996 would have said, no, I'm going to wait until there are better drugs, they would have been dead. There's a lot of very smart minds working on COVID vaccines. I think we're going to get much better vaccines. I think we're going to be talking in 3 to 5 years about very different vaccines.
NTF Special Advisor Ted Herbosa says the COVID-19 pandemic has tested the limits of the Filipino bayanihan spirit. Herbosa says fighting an invisible but great enemy has allowed many Filipinos to set aside personal differences to launch a unified fight against COVID. Still, he says the COVID-19 crisis has also revealed the ugly truth about the state of healthcare in the Philippines.
We've discovered gaps in our health system we've never discovered before. We've realized how important our health workers are, that we export to other countries. They're glorified in other countries that also took a handle and a beating, and their health systems were all beaten up as well.
But OCTA research fellow and molecular biologist Nicanor Austriaco says there is a lot to be proud of regarding the country's pandemic response. He says the Philippines has handled the pandemic better than other countries such as the US.
I can compare my two home countries. I can compare the numbers, I can compare the deaths. And when I speak here in the United States about the relatively low numbers that we have as compared to in the Philippines, as compared to the States, they're completely shocked that the Filipino people have been able to keep the numbers down, especially given the limited resources that we have.
Presidential Advisor for Entrepreneurship Joey Concepcion says we have no choice but to hold back on reopening the economy if the COVID-19 situation gets worse. Concepcion has been advocating the reopening of more industries, saying it's the only way to save small and medium enterprises from dying out. But Concepcion says the government should also focus on the vaccine rollout, especially with infection surging.
That's why we have to speed it up in vaccinating our people. But we're only starting now, and so we have to give this a chance. No? So let's see what happens. I'm not saying open the economy openly and let's go and start allowing tons of people to the moon. I'm not saying that. I'm saying let's calibrate all the time. And if things are not going well, let's hold. No? Let's hold. And let's wait for the rollout. And as things improve, then you open it up again. No? And pull back if it's that. So I think that's the way to do it.
Meanwhile, economist and Marikina Representative Stella Kimbo says the government should provide more cash assistance to affected Filipinos. She points out that economic recovery will remain a dream if the public has nothing to spend to keep the economy running.
Cash assistance is certainly not enough. But under Bayanihan 2, Congress authorized a spending of 165 billion. 25 of that is standby fund. But, Robbie, 55 billion of the 165 billion is for loans. Robbie, walang uutang ngayon na MSME. Takot lahat. So, a third already of your Bayanihan 2 is, at this point in time, sleeping funds, right? And only 6 billion ang ayuda under Bayanihan 2. Napakakaunti ng 6 billion.
Pope Francis recognized the strength of Filipino faith as he presided over a mass to mark the 500th anniversary of Christianity in the Philippines. The Sunday Mass in St. Peter's Basilica started with a procession in traditional Filipino costumes. It was celebrated with several representatives of the Filipino Church, including Cardinal Luis Antonio Tagle. In his homily, the Pope recognized the strong faith still offered by Filipinos, 500 years since receiving their first Christian gospel.
Cari fratelli e sorelle, sono passati 500 anni da quando per la prima volta l'annuncio cristiano è arrivato nelle Filippine. Avete ricevuto la gioia del Vangelo, che Dio ci ha amato a tal punto da dare il suo Figlio per noi. E questa gioia si vede nel nostro popolo, si vede nei vostri occhi, nei vostri volti, nei vostri canti, nelle vostre preghiere, la gioia con che voi portate la vostra fede in altre terre.
And that's how the day is shaping up to be. Join us later at 10 a.m. as we monitor the day's biggest stories from sunrise to sundown. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.